Hello and welcome to COVID Conversations here on WNCU 90.7 FM. We are streaming on YouTube and on Instagram. I'm Kimberley Cartwright. I'm your host. I'm the News and Public Affairs Director here at WNCU, and we're using the Zoom platform to talk about how COVID-19 is affecting our world. We've been fighting through COVID and wishing it would go away, but alas, it is still here. And with me today to talk about COVID and why we are so over it mentally is Cornell, Wright. He is the Chief Health Equity Officer for the Alliance for a Healthier Generation. Hello and welcome.
Hello, thank you for having me.
Oh, it's my good pleasure. I love meeting new people, and I love meeting people who are really invested in making sure that people have information about COVID-19. So you're a very welcome guest, and I appreciate you.
Thank you.
Okay, first of all, I read in my research that Americans are reporting over like 161 million COVID-19 cases over the past 2 years. There are like hundreds of thousands of people in the country that could potentially be affected by COVID as it continues. When you hear that, what are your feelings?
Yeah, what my feelings are is that this is something that's not going away. It's still around and it's still affecting many of us. And if we let our guard down, then we have to be extremely careful on how we interact with each other and how we go out in public. And so some of those safety precautions that have been helpful in the past, like masking and washing our hands and, things of that nature, are still effective in, protecting ourselves. And not being all in people's faces is another thing, because it's an airborne type of issue that we're talking about. And so as people call for sneeze and there's no protection there, we could still spread.
Yeah, I remember that. Everybody remembers that everybody's masked all up. And then if somebody coughs in the grocery store, then everybody's running for the hills or running for cover with our masks on. So tell me, why are people so over COVID?
Well, if you go back to like basic human nature, people like to feel comfortable. And even to myself, masks aren't the most comfortable things to wear or to do in public if you're not used to doing that. And so as people lose a little bit of that comfortability, then we lose a little bit of the things that make us us, and in a sense. And so people are 2.5 years in and we're just tired, right? But it's still we still have to protect ourselves and others. And when we talk about even mask wearing, we see a lot of people that don't do it properly. If it's not covering your nose and your mouth, you're not really protecting yourself or anybody else. So people are just tired of hearing these messages. But people in the public health world, this is what we do every day. And so for us, it's like a sense of urgency, where for others, it's not as urgent, especially since we've gotten more protective measures, whether it be vaccines or monoclonal antibodies or any other types of treatments that can help prevent hospitalization, severe illness, and death.
So, okay, let's talk about like masking and social distancing as key tools to prevent the spread of COVID. Are those practices still viable? Because everywhere I go these days, I see people who are not masked at all. I'm still, armored up with my mask, but there's so many people out there who are not armored up with their masks, and I get the glares and the looks now, not so much as like when everybody else was masked up. So are these practices still viable for protection?
Yeah. In a large case of the bigger scheme of things, yes. So I still mask, and my family still mask, and we've been very blessed and very fortunate not to have contracted COVID-19. And I will make a change. You said social distancing. That was something that was big early on, and it's really more physical distancing, because you still want people to be social. We still want you to have a connection with other people. But that physical distancing was very important. And as you see historically, as things got more relaxed, numbers started climbing back up. And you're starting to see that now even more so. Whereas, I was just coming back from vacation, and wearing masks on the airplane is optional now. But you'll still see a good number of people that mask up. Even one of the flight attendants, on our last flight was masked up. And so there are a lot of us that still want to be protected and not have to deal with this unnecessarily. And so, but we're seeing numbers climb up, and then we're seeing other things pop up too. But masking has been very helpful, regardless of what certain segments of the population may think about it.
So I want to talk about the latest maybe COVID variant. We've been through Omicron and Delta. There's a B virus. I remember the numbers, but what's the latest variant? And then why should people be concerned about it?
Well, I'm gonna tell you, these variants are popping up like so fast. I can't even keep up as much as I should, right?
Yes.
So what happens is you have the initial COVID-19 virus, and it keeps mutating. And so what we keep seeing is that it's learning. And so with your initial vaccinations, it was fighting, a certain type of COVID-19. Now that the vaccine's been out and different variants have popped up, we're seeing that this is a learning kind of thing. So the virus is mutating as it learns, so it can, the vaccines and the boosters are more or less effective because it keeps changing. And so what's important though is to stay up to date on your COVID-19 vaccines and your boosters. I just got my second booster recently, and it helps, right? But also the protective measures help. What we need to learn is that as long as this thing is still around, it's still going to keep mutating, and hopefully it doesn't get worse. But you want to kind of get to a point where you can handle it a lot better. And we've seen lots of strides, but it's one of those things that it's so new that everybody is still learning and still researching as we go. So it's unprecedented times that we're in, because I can't think of a time where in my life, and I'm only like 42, that we've seen something like this happen, that we had such a response so quickly to help mobilize the public health systems of support to help people stay alive.
Yep. So in your opinion, if COVID is still such a threat, then why is communication down about it in the very near past? Every day there would be a story about COVID numbers going up, down, number of people who were infected, how the variant was making its splits, but now there isn't so much chatter about it.
Well, you being a media person, you can understand the news cycles shift, and whatever is more important in the news cycle is what's going to be front and center. In public health spaces, COVID is still important to many of us, especially the practitioners of public health, and in school systems, it's important, and in nursing homes, in churches, it's still important. It may not have that front page, kind of mainstay power as it did when it was fresh and new, but it's still important. But you're hearing things about like monkeypox and other things that are taking those spots, and other news items that may be on there. So people have what they call COVID fatigue, where they're just tired of hearing about COVID because it stayed in our news cycle for so long as the main story. And so now people are trying to shift away from it, as if we don't think about it or don't talk about it, it'll go away. But that's not working either.
So in my research, I read that the numbers are still really high among people who have not had a single vaccine, not anything. So when you hear that, does that surprise you?
It doesn't, because if you think about the historical context of medical experimentation in this country, especially on Black and brown people, it has always been a factor. And then you add in other components of how things become politicized. It adds in a whole nother component of people not having trust in systems. And when you don't have trust in systems, people aren't going to be as quick to adhere to that type of guidance.
So, so what does that tell you about this whole thing? Like, what does not getting the vaccine at this point in the game tell you about people who are not getting vaccines?
Well, we've got to do a better job of meeting people where they are. And, we talk about, trying to, look at those drivers and determinants of health that can greatly influence one's health and well-being. We got to meet people where they are. If people are not as worried about getting COVID because they have to get their lights or their food, or, transportation issues taken care of, then we have to also, while we're trying to, do these interventions to protect people from COVID, we also have to meet them where they are in their normal everyday lives, because at the end of the day, that problem is still going to exist whether they have COVID or not. It may compound it by having COVID, but if people are in fear of losing their homes, losing their jobs, COVID is just another thing to add to the list of them. So we have to meet people where they are and help their current situations so that we're doing whole health wellness and promoting health equity at its highest forms. And that's where we talk about, meeting people where they are, but also in ensuring that people have the greatest opportunity to have good health and well-being and have it sustained.
So you're out and about in the community. How are people of color doing as far as the pandemic is concerned here in our region?
It's kind of mixed, right? So you've got people that are doing really well and have avoided it, but then you also have people who have gotten vaccinated in some form, whether it was one dose, 2 dose, or they've gotten all there's some people that are all up to date. There's some people who have a variation of something, and there's people who have nothing, like you were saying earlier. And what we've seen now is that there are measures, unlike how COVID first started, there are measures now that can help protect us. So even if you get COVID, we've got some things in place medically that can help assist. I talked earlier about like monoclonal antibodies and other types of treatments, these therapeutic treatments that can help people who have gotten COVID and are seeing certain types of symptoms and signs. You can go into medical facilities, hospitals, or whatever, and get certain types of treatments that are more widely available than when we started. And that's the biggest difference is we didn't have vaccines and these treatments when COVID started. And so that's why we saw so many deaths up front, especially with, in our historically marginalized populations and communities. Most of our Black and brown communities were having high COVID cases, especially in North Carolina. We were having high COVID cases, and in our Black communities, we were having high COVID deaths. And so when you look at those disparities, those inequities, those unfair differences that we see, that comes from a lot of other factors that we've seen throughout the years that had nothing to do with COVID. COVID added on to those issues. And so we keep, plugging away and trying to educate and inform people by, shows like this, or, working with our faith communities or working in the barbershops and other areas, our school systems. And it's important to keep pushing those messages. Even if people are tired of hearing them, it's still, we have to make sure that that information is available. On a state level, our local, health departments, our state Department of Health and Human Services are great tools and great resources to get information.
So finally, what is your best practice to prevent the worst consequences of COVID and help to turn the page on this pandemic, especially as we progress in time into the fall?
So I would say people need to stay informed, stay protected, meaning if you can mask up, please do. If you can get all your shots in terms of like vaccines and boosters, that's something you can do, that's a good option. And just be very mindful of how clean we can be, whether it's our surfaces, whether it's our hand washing, and just stay in the loop and stay in the know, because that's what's going to be important. As things change, guidance changes. And as that guidance changes, staying up to date with that is going to be extremely helpful. And sharing that information with others, especially our younger and older populations that may not be as tech savvy as some of us, that may not get that information as quickly. And so the being a good neighbor is something that I always talk about with people to help save a life and share a resource.
Okay. Cornell Wright is the Chief Health Equity Officer for the Alliance for a Healthier Generation. Thank you so much for your time. I appreciate you.
Thank you.
Yes, and thank you, audience, for watching via YouTube, Facebook, and Instagram, as well as listening on WNCU 90.7 FM. We want you to like us, we want you to follow us, and we want you to subscribe to our pages to see more of our archived shows. I'm Kimberley Pierce Cartwright, your host, and we thank you so much for tuning in.